Hello, everyone. For the first part of the presentation, we'll discuss the essence of a doctor's work from 5 perspectives: professional communication, empathy, staying calm under pressure, passion for teaching, and long-term care. In the essence of a physician's role, there is the constant balancing of not only acquiring vast knowledge, but also transmitting it in a clear, accessible way. Physicians are educators as much as they are healers, and their ability to break down complex medical concepts and to understand the language is a key part of their work. For example, in my observations in gastroenterology and psychiatry, we witnessed how doctors took the time to simplify intricate medical explanations to ensure patients understood their diagnoses and treatment options. A hepatobiliary specialist in gastroenterology patiently explained liver function, the implications of cirrhosis, and medical regimens in a way that empowered patients to take an active role in their care. Next, we wish to cover the significance behind establishing a trusting and empathetic relationship with the patient. This isn't just about medical knowledge, it's about connecting on a human level. In gastroenterology, cancer patients often face not just physical symptoms, but an overwhelming sense of fear and uncertainty. The ability of physicians to gently provide encouragement and emotional support in addition to medical treatment was profoundly impactful. A gastroenterologist's words of support can transform the patient's approach to their diagnosis, helping them confront the reality of their illness with strength rather than fear. In emergency medicine, the physician's role goes beyond stabilizing the patient physically. It extends into reassuring the patient and their family during moments of intense distress. At its core, every doctor has to balance knowledge and human interaction. It's about not just diagnosing and treating diseases, but about connecting with people on a deeper, more profound level. It is about the careful transmission of knowledge in a way that empowers patients to make informed decisions about their care, and it's about the emotional strength and empathy that physicians bring to their relationships with patients. In essence, the physician's role and work encompasses not only the science of medicine, but the art of healing, both in body and in spirit.
When I was making observations in the emergency room, there's a lot of people suffering from trauma. Many of them were cuts and wounds that need to be surgered right away. And I'm aware that during the operation, the patient may go through severe pain, and especially during the injection of anesthesia. So due to the pain, the patients may struggle or resist really hard. So doctors need to stay focused and ignore those distractions. However, the doctors still manage to comfort the patient while asking them if the pain has been reduced or not. From this example, I understood that doctors have to cope with any kind of situation, such as overwhelming numbers of patients and limited resources. So it's crucial that doctors are able to remain calm, endure pressure while determined yet performing their treatment.
Doctors are teachers, companions, and pillars of strength for their patient. Our time of serving in the hepatobiliary department and cancer center gave us a deeper understanding of what it means to truly embody the role of a doctor. One of the most inspiring things we observed was how doctors use their clinical work as opportunity to teach. In the hepatobiliary department, we watched a doctor explaining a complex case of liver disease to his patient. It wasn't just a discussion among patient and doctor. He invited us to join in. What struck us most was his patience. He paused to ensure we understood, answered every question, and even recommended resources for us to read later. In the cancer center, we observed a similar approach. The doctor was explaining a treatment plan to a patient, translating complex medical terms into simple explanations they could understand. Later, he turned to us students and discussed his decisions, emphasizing the balance between clinical evidence and patient-centered care. Next, in hepatobiliary and gastroenterology clinics, we saw the importance of long-term care. When patients with chronic hepatitis have been coming for follow-ups for years, the doctor carefully reviewed their latest test result and made adjustment to their medication. But what really stood out to us was how he spoke to the patient. He didn't just focus on the numbers. He reassured them, celebrated their small victories, and reminded them that they were making progress. These moments showed us how crucial it is to build trust and stay by a patient's side, no matter how long the journey might take. Throughout our time of serving, we saw that doctors do so much more than diagnose and treat. They build relationship, inspire confidence, and provide hope. Every interaction with the patient, every teaching moment, and every word of encouragement is a testament to the heart of a healer. Medicine is not just a science, it's a blend of knowledge, patience, and humanity. Watching these dedicated professionals in action has inspired us to strive for the same level of compassion and commitment in our future career.
And this page gives you guys a quick peer into what we're doing during the activities. Take me as an example. I was fortunate enough to be able to participate in a small operation. And the rest of the other photos are also from our group members. They can display the working environments of doctors.
So next, we're going to talk about the importance of communication in a medical setting. Communication is key. You have probably heard about this phrase many times, but it is especially important in a medical setting. Effective communication can make the difference between life and death for a patient. Patients are more likely to follow doctors' medical advice when the doctor is trusted. But how will you build trust? 3 shadowing sessions doesn't sound like much, but it sure broadened our perspective and allowed us to have a clearer picture of what to expect when we finally become doctors. All 3 doctors that I shadowed were super nice, and I noticed that one of them, the one from the Department of Family Medicine, would almost always start the conversation with a compliment. Like, what statistic is well maintained in the patient's health examination report? Or telling the diabetic patient that she has seen the dedication and progression in their dieting. She tries really hard to cheer them up. And in some occasions where things aren't looking that great, instead of yelling at them, she would ask them what happened in a joking manner and encourage them to do better next time. We can really tell that she is trusted by the patient, since most of her patients decide to follow her back to Gaoyi instead of staying at Datong, where it is more convenient geographically. And she also keep emphasizing the importance of speaking the patient's language, where 70% of all communication in Sangao Menzhen is kept in Taiwanese. Then here are some of the memorable lines. One of it is, 我们换成这种药啦，这种药对长辈来说是安全的。This shows how considerate she really is and how she treats almost everyone like her family. And it is just a little bit unfortunate that with all the trust we clearly observed during the shadowing session, multiple patients still say, 药我没有很认真在吃啦，所以数字不是很好看。And I think the 3 shadowing session really means a lot to me, and I hope to attend more in the near future. And that's my part. Thank you very much for listening.
Hello everyone, I'm Stephanie. I would like to share you a story about a patient who only speaks Korean. This was happened when I went to the rheumatology and immunology clinics. This patient was a woman who looks like 30 years old. For she spoke Korean only, both the Dr. Ling and her had no idea what each other was talking about. Fortunately, a co-worker accompanied with her as an interpreter. The doctor started to explain the hematology test report, and he wanted to make sure that the patients fully understood. Even though the interpreter helped translate the context, Dr. Ling still tried to communicate with patients by himself. He first took the pen and paper, wrote down the simple English keywords, and drew some diagrams to help the patient understood. It was really hard for communicating without speaking, as I observed. Every time that the interpreter translated a word in Korean, Dr. Ling will look at me with a bitter smile, which meant I can't understand, and I really hope that the interpreter translating the right way. Since the patient really realized the diagnosis is crucial, that is the reason Dr. Ling still tried hard to make his word make sense. After some time, the nurse side thought out a better solution: use the online translator. In this way, Dr. Lin and patients could understand each other more clearly, since AI translator can interpret the whole sentence without a word missed. They began to try the method. When they succeed, butterflies clapped happily. The patient was more willing to speak and interact with the doctor. This truly helped Dr. Lee understand her situation. Both visualization and AI translator are just the tool. The doctor who willing to communicate with patients can use them to help the patient properly. Without the doctor's efforts, relationship won't be built and the patients won't fully understand the diagnosis. That is my part. Thank you, everyone.
Hello everyone, I would like to share my observations and reflections on the importance of doctor-patient communication. I realized how crucial effective communication is in medical practice. For instance, in a neurosurgery outpatient clinic, I observed a doctor who remembered each patient's medical history, carefully performed examinations, and used different language to communicate clearly. This built trust and made patients feel understood. One case involved an elderly woman with a worsening aneurysm, numbness, and intermittent seizures. The doctor's ability above mentioned helped her stay optimistic despite her challenge. She remained sober and talked about every details of her condition. This composure could be attributed to the doctor's ability to clearly explain her condition, recommend relevant tests like brain MRI, and coordinate follow-ups with specialists like neurology, which generated a win-win outcome. Moreover, understanding the timing and the nature of symptoms like seizures or numbness is essential for deciding the right test and therapies. In busy clinics, where doctors handle complex cases like spinal issue or cerebral aneurysms, staying focused and clear is vital for both the physician and the patient. Lastly, addressing patients' emotional state is just as important as treating their physical condition. Acknowledging their experiences and maintaining a supportive tone fosters trust and cooperation. In summary, effective doctor-patient communication is the foundation of accurate diagnosis, successful treatment, and positive outcomes. Thank you for listening.
Hello, I'm Jean, and I want to share my observation on how disease impacts the patient. When I was in the radiation oncology department, I met an old lady with a third stage of colon cancer, and she entered the clinic just like this picture, in a wheelchair with a weary face. This time is her follow-up appointment, and she was suggested by the doctor that to undergo chemotherapy in the next few months. So the Dr. Lee, the doctor I followed that day, told her that she needs to consume more nutrients. And she responded with a weird question. Can I eat beef? She said. Dr. Lee asked back, why beef? Why do you think eating beef is good for your nutrition? The lady started to slowly review her life. She said she ate simple meals every day, non-sugar oats, vegetables, something only boiled. And she said she had already taken good care of her children after her husband died a long time ago. And she focused on her work too. However, she still had the cancer, had this disease. Now she just wanted to go, not to bother her children. And this story really makes me want to cry. Back to this topic, back to this slide. She says she eats simple meals, which often thought to be good for health. And I think one of the reasons that she asked doctor whether she can eat beef or not is because in traditional concept, beef is good for nutrition. Beef is nutritional. However, beef is also expensive. And if the doctor say yes, she may have to spend more money on the beef to get nutrition, and this can cause a lot of pressure on her. Anyway, back to this story. I can see this cancer casting a shadow on her life, smashing her life like a bomb, reaping her life qualities, and she couldn't understand why this happened to her. So she refused to accept it, but keep looking for the reason for this cancer. In my opinion, it is because of our culture that makes her start to question herself. Am I doing something wrong? Why me? Why this cancer? But it's not true. The disease didn't come to you just because you do something terrible, you do something awful. There are too many factors and possible reasons. It can surely be out of nowhere. It can be no reason at all. So no one should be blamed for getting a disease. So is this old lady. To sum up, as a student, a doctor, and a granddaughter, I think what we can do is to tell him or her, you've already done enough. Now you should focus on your recovery, which is the most important thing right now. Moreover, we should find some time to let them tell their stories. Support them with your true heart. That will make them feel better. And this can change everything. This is the end of my observation. Thank you.
Hi, I'm Pei-Wen, and today I will be presenting one very crucial role of doctors, which is to try our very best to maintain the life quality of patients despite their sicknesses. So this slide shows the two main diseases that the Center of Prevention for Special Hematological Disorders treat: thalassemia and hemophilia. Next page. When I was making observations in the clinical room in the Center of Prevention for Special Hematological Disorders from the pediatric department, I saw patients born with diseases that require them to visit the hospital regularly for blood transfusion. Through proper treatment, a lot of patients are able to maintain an almost normal lifestyle, and many of those visiting the doctor are already grown-ups. It's a relief to see that they have lived past through their childhood years despite their diseases and continue to go through treatment to stabilize their condition. Dr. Lin, next page. Our instructor had also taught us knowledge and history of research on the field of hematological disorders, giving us a better understanding of the patients and their symptoms. Next page. The blood transfusion area in the center was also quite spacious and close to the clinical room, giving patients the most comfortable and convenient environment when receiving treatment. Unlike a lot of crowded waiting rooms in the hospitals, the center made sure all patients had enough space to rest during their treatment. This made me realize that a doctor's job is not only to cure diseases, but also to focus on how to improve the patient's life quality by helping them maintain a healthy lifestyle. As future doctors, I believe we should keep in mind that we may not be able to solve every disease, but we can try our best to alleviate the pain caused by illnesses. Thank you for listening.